All right, and our final talk for the evening. Please join me in welcoming Dr. Karen Cowgill, an epidemiologist and new assistant professor in our division. And she's going to be speaking on studying diseases in populations, using data to foster health outcomes at home and abroad.
Okay, great. Thank you, Erica. Well, as Erica said, I'm new, and it's really exciting to hear about all the work that my new colleagues are doing. I have to say my kind of work is very different, although after listening to David speak, I thought I really need to get together and talk with him. So the title of my talk is Epidemiology in Tacoma and Beyond, and also that long subtitle that I forgot about. But actually, what I'm going to talk about is death. So we know there are many nails in humanity's coffin. Infectious diseases like AIDS, tuberculosis, malaria, antibiotic-resistant infections, measles, diphtheria, and the list goes on. There are non-communicable diseases like cancer, heart disease, chronic obstructive pulmonary disease, diabetes, or Alzheimer's disease for that matter. Mental illnesses like depression, bipolar disorder, schizophrenia, and injuries, whether unintentional or intentional. So the list is long. We're all familiar with and affected by these plagues. I don't want to be a downer. But these things cause not only death, but also disability and illness, right? So as we said before, and as other speakers have said, the biomedical sciences as a whole aim to loosen or remove these nails to prevent death or disability. And you've heard about that, some specific projects from David, John, and Mark. I'm going to tell you a little bit about how my particular field, epidemiology, addresses these issues and contributes to helping people live long and healthy lives. Okay. So what is epidemiology? Epidemiology is considered the basic science of public health. Epidemiologists are disease detectives, so you may have seen the movie Contagion, for example, in which, what's the name of that actress? The British one, Kate Winslet plays an epidemiologist, okay? So epidemiologists are disease detectives who investigate causes of poor health, disability, and premature death in human populations, who predict who's at greatest risk, and test and implement ways to prevent and control those bad outcomes. So it's a tenet of epidemiology that disease does not occur at random. We try to tease apart the strands of complex webs of causation to understand why one group is at greater risk than another. We want to pry open, to continue that metaphor, pry open the lid of the coffin so people can live those longer, healthier lives. And I want to underscore here that epidemiology is important not only for students who plan to go into public health, but also for those who plan to become clinicians. Because even doctors and dentists and therapists who work with patients one-on-one rely on the evidence about what works and what doesn't that's generated by epidemiology. Epidemiology draws on many disciplines. It requires an understanding of the human body and how it's changed by disease, but also comfort with math and statistics, since epidemiologists use data from large samples to draw inferences about health outcomes. So sometimes the information epidemiologist analyzes as simple as counting the number of cases of disease and describing who it affects and when and where it happens. John showed a great example of that in his Alzheimer's slide with those pills getting bigger and bigger over time. Though that kind of just simple descriptive information can really help policymakers direct funding where it's needed and help public health officials determine if a disease is on the rise in a particular place or at a particular time. Sometimes epidemiologists figure out the cause of an outbreak, like some of you may remember the 1993 Jack-in-the-Box outbreak, in which it was discovered that E. coli 0157H7, a particular strain of bacterium, was responsible for causing hemolytic uremic syndrome in children. Those of you who don't remember back to those days might remember the more recent outbreaks at Chipotle restaurants and other foodborne outbreaks, for example. That's one example of epidemiology at work. But sometimes epidemiologists collect data on groups of people over time as a natural experiment plays out. So an example of this would be those pivotal studies in England in the 1950s that showed the link between smoking and lung cancer. And this is something we all take for granted right now, but that's thanks to epidemiology and thanks to those studies that were done at those times. And then sometimes epidemiologists mount studies like randomized controlled trials to see if interventions such as new medications, like the types of things that John is looking into, vaccines, screening tests, information campaigns, to see if those things are effective at reducing health outcomes and to actually look quantitatively to see if there's evidence to support the success of those interventions. Epidemiology is a really broad field. Some epidemiologists focus on risks at the molecular level. Some look at social and structural determinants of health, things like income inequality and racism. So the beauty of epidemiology, at least to epidemiologists like me, is that it's so adaptable. So in my own career, I've had the fortune to work in public health at the local, state, national, and international levels, as well as to do research. And the thing that I love is that there's always something new to learn about and so many ways to do epidemiology. If you study epidemiology, there are a lot of places it can take you. And in a few minutes, I'm going to tell you about some projects that students in our biomedical sciences program could participate in. But first, I want to give you a flavor of the range of possibilities by sharing some of the examples from my own career. So as a public health epidemiologist, I focused on non-sexually transmitted infectious diseases. Okay, so that's a mouthful, but infectious diseases that don't include AIDS, don't include other STIs that you might have heard about, and they get a lot of play up the road at UW Seattle. But my interest has always been with some of the other bugs and pathogens. For example, I got to participate in one of the first investigations that linked Salmonella bacteria to alfalfa sprouts. That was in Arizona when I worked there. Responded to an outbreak of meningococcal disease at a high school in Idaho, helped to investigate the first cases of West Nile virus in Illinois, and also, believe it or not, actually investigated an outbreak in the U.S. Virgin Islands, Legionnaire's disease in a group of tourists there. So when I was a grad student, I started to work globally and to do international work, and I went to Egypt to investigate the hypothesis that certain types of lymphoma, which is a type of cancer, were actually associated with chronic infection with hepatitis C virus. And then I went on to work at the Centers for Disease Control and Prevention, where I got to continue doing some of that global international work. I went to Kenya to help assess the extent of illness in infants due to a bacterium called Haemophilus influenzae type B, and also to look at the success of a vaccine that would prevent that. So, and I've done some other work in vaccines, working in Seattle locally at a nonprofit biotech to assess a new vaccine against a parasitic disease called leishmaniasis. So there's a lot of different sorts of things that, with just the basic skills and toolbox of epidemiology, people can do, right? And so you might be asking, what am I working on now, and what might students here at UW Tacoma get involved in? So I mentioned my interest and experience in working internationally, and that's really where a lot of my passion lies. My current focus is on maternal mortality, infant mortality, and diseases of childhood. And maternal mortality would be death around the time of childbirth. So you might know that many of these are most severe in sub-Saharan Africa. I have partners in one area, the Democratic Republic of the Congo, where we're working to find out how many kids under 5 have received routine childhood vaccinations. And this is important, not just because there are still a lot of vaccine-preventable diseases in some areas of the Congo, like measles, huge measles outbreaks, for example, but also because we hope to shed light on some of the structural issues in the healthcare system that prevents kids from getting fully vaccinated. And that's a project that is currently in the data analysis stage. So along those lines, we're also interested in looking at maternal and infant mortality and in factors that influence whether a woman will go to a hospital to give birth and what affects the quality of care that she and her infant get there. So we have another study in the Congo, a small study that is also in the analysis stage, where we're looking at women who were detained in the hospital with their infants after giving birth because they couldn't pay their bills. So that's a practice that's fairly common in a lot of countries, but there's not a lot of reliable data about how frequently it occurs, to whom, and what the consequences are. So still in the DRC, we have proposed a study to look at a simple intervention that can save the lives of babies who are born either prematurely or with very low birth weight, and that intervention is called kangaroo mother care. And this is something that was actually developed by a pediatrician in Colombia in the 1970s, but I understand that it was also featured on the TV show Grey's Anatomy. So some of you may be familiar with it from there. It's actually also an intervention that is very effective, not only in developing countries, but also in countries like our own, where we have high resources, but in fact, it can have better outcomes than using technological devices like incubators that are not always available around the world as well. So, of course, it's not only in Africa that women, infants, and children are vulnerable. I'm new here, and I'm really interested in developing collaborations with other organizations and institutions locally. I've already spoken with some folks at the Tacoma Pierce County Health Department, and they're interested in doing some studies together to look at vaccination rates here locally. Antibiotic resistance is another big concern, and another area of interest that I'm particularly passionate about is promoting breastfeeding as well. But I know that we have other partners in the audience, for example, some of the healthcare organizations, and certainly hoping to develop some collaborations and projects with them over the longer term as well. So there's a lot going on. There are a lot of ways, as you've seen, for students to be involved in these and other research projects, and I hope that this short talk has convinced you of the beauty of epidemiology, that there's really something in it for everyone, and that it's a key part of the biomedical sciences picture. So, thank you.